Once we go into the community, we are often limited by the amount of imaging we have available. But having said that, hyperopia in general, be it in the community or in the clinic, is best diagnosed by a simple objective method known as retinoscopy. In retinoscopy, we shine a light into the eye of the patient and observe the reflex. Based on this reflex, we neutralize it with different powers of glasses and hence determine what is the correct correction for a given pair of eyes. In hyperopia, it is essential that the ability to generate power, which is known as accommodation, is arrested using certain drops called cycloplegic agents. This is often the gold standard for any sort of refractive error in children up to the age of 16. What this does is it pulls out all the latent as well as the manifest hyperopia, giving us the exact power to be given in a given child suffering from hyperopia. Normally, for refractive errors as we know today, especially myopia, which is nearsightedness and astigmatism, we have refractive laser corrections, surgical corrections, refractive lens exchanges, which help correct the refractive errors. While these can be done in hyperopia as well, the dependability or the repeatability and the accuracy with which these surgical procedures correct hyperopia is not as high. Having said that, a proper, well-performed cycloplegic refraction followed by full correction of glasses which are age appropriate constitute the best treatment modality for hyperopia. Of course, there are contact lenses which can help mitigate the use of glasses, but refractive laser surgery is still not there yet with respect to the accuracy and safety in hyperopia. It is still being practiced, but it needs to be practiced in very safe hands, and the post-operative expectations have to be very clearly set before these procedures are undertaken. Lifestyle factors normally do affect the progression of myopia. We are in the middle of the myopia pandemic, especially in Southeast Asia, including India. Having said that, lifestyle factors do affect the progression of hyperopia. Uncorrected hyperopia, especially in people who have high demand of continued near work, often leads to worsening of hyperopia and worsening of symptoms associated with it. So it is very essential to identify the hyperopia and detect it, objectively measure it, and treat it in a full and clean fashion to ensure that it does not worsen and its associated symptoms do not affect our daily life.